everyone, and welcome to a special edition of Mental Health Matters with your host, Dr. Matt Gloviak. I'm here today to talk a little bit about COVID-19 and some of the mental health implications that we may consider as we continue to move forward in this entire pandemic, which has brought about a lot of uncertainty. Now, I know that there are a lot of opposing views in terms of how we see the entire situation. For some of us, we think that our nation is overreacting. For others, we think we're underreacting, and there's a lot of thoughts in between. However, the reality of the situation is that regardless of which end you fall on, whether you think we're overreacting, underreacting, or somewhere in between, the reality of the situation is that we are all in this together. Now, when we do face situations of uncertainty, that can lead to a lot of negative mental health implications for all the individuals involved. As many of you have already experienced the contagion that we have witnessed here at our local stores. For instance, individuals are having a hard time being able to secure important necessities for life, such as toilet paper, paper towels, hand sanitizer, food, so on and so forth. And with that, we're seeing a lot of situations where people are panicking, going from one store to the next, trying to buy everything out online, overstocking themselves, and price gouging. Now, all these types of situations are continuing to make the situation worse for everybody. So one of the things that's going to be really important here is we do go through and we try to work through this situation together. It's very important that you do take the time to be mindful as to what it is that you need to appropriately do and not do to be able to work through this type of situation. Now, with the contagion I just explained here, a lot of people are feeling very frustrated, and with this frustration, it can lead to a lot of issues where individuals begin fighting one another, acting out in inappropriate types of ways, completely making the situation worse. And for many individuals, it can be a scary time to go out to the stores because first and foremost, being worried about contracting the disease, but secondly, being worried about being rushed by mobs of individuals all trying to grab the same necessities that all of us need for our everyday life. There's a lot of individuals who are feeling very anxious about what's to come. Uncertainty is something that does lead toward anxiety. As we know, anxiety generally comes from predicting a future that is unknown and starting to excessively worry about that. And the reality of the situation is that there is a lot of conflicting information out there in the media, social media, and so on. The reality is that we're not going to know ultimately what's going to happen until it happens. And the fact of the matter is that right now, as we see it, there are continually increased numbers of individuals who've been contracting COVID-19, and there are also continually increasing numbers of individuals who have ultimately passed away from it. Here in the community of Bolingbrook and other surrounding communities, we've already begun to see some confirmed cases of COVID-19. So with that being said, it's going to be extremely important that we all work together to be able to make the situation something that we can all be able to work through accordingly. So with that being said, you're strongly encouraged to keep in mind the mental health needs of not only yourself, but other individuals. And what I'm getting at with this one, especially when you're thinking that there's an overreaction to the situation, we need to keep in mind that there are many vulnerable populations out there. Now, fortunately, the information has shown us so far that for children and, for young children, young adolescents, it doesn't seem like they're quite as at risk as some of the elderly population, or we see individuals with autoimmune disorders. So while you may not consider this to be something life-threatening to you, it's just going to come and go as a cold, we have to think about all the other people. And this is where our nation needs to be able to work together to be able to persevere through such a situation. As we see, there are going to be a lot of changes. The economy is struggling quite expansively as we see major companies shutting down, individuals are being laid off, hourly employees are wondering where they're going to be able to get their money. Again, this is a major issue that many people are going through. With the schools shutting down, what are we going to do with our children? And with them, how do we explain what is happening to our children so they feel safe and secure? And what are we going to do with them all day to be able to keep them, occupied and so on and so forth? So throughout the rest of this little mini-series, what I want to do is be able to share some different tips and strategies in short little videos, not the traditional 28-minute video that I've been sharing with everybody, so that you can select the ones that are most appropriate to you in the situation that you're facing and be able to make informed decisions. Again, regardless of whether or not you think we're overreacting or underreacting to this situation, it is important to recognize that this is the reality of what we're facing. If you do believe that you are in a state of psychological distress, please do note that there are a variety of resources available. For those those of you unable to attend face-to-face live counseling sessions, many of your local providers are currently offering telemental health services via some type of HIPAA compliant video platform, or you can actually make phone calls. In other cases, there are national and local resources that are available. On the screen, you'll be able to see some of these resources are provided through SAMHSA and NAMI. You may feel free to give these numbers a call, and you may also text, and it is very important, again, if you find yourself in a vulnerable position, to follow up accordingly. Thank you.